Uganda's health sector is facing a major test as thousands of donor-funded health workers find themselves in limbo following a sudden halt in funding by the United States government. The Ministry of Health has now launched a national validation exercise to assess which of these affected workers can be absorbed into the public system. The exercise kicks off on July 14, 2025. This comes after the U.S. government suspended all funding under its development objective agreements, a decision connected to a directive that originated during former President Donald Trump's administration. The freeze affects USAID-funded programs across multiple countries, including Uganda, disrupting critical health services such as HIV treatment, maternal care, and disease surveillance. Thousands of Ugandan health workers employed under these programs were recently issued stop work orders. Speaking to the media, Ministry of Health Permanent Secretary Dr. Diana Atwine confirmed the aid suspension but emphasized that Uganda's health system remains functional. Yes, our partners have communicated that following the U.S. presidential executive order, USAID-supported activities are paused to allow for internal reviews, she said. However, our health services remain operational and ongoing. In a circular issued on June 30th, the ministry instructed hospital directors and district health officers to begin validating affected staff. Workers are required to submit their academic documents, updated CVs, performance reviews, and valid registration. Dr. Atwine reassured the public that Uganda's health system is not entirely reliant on U.S. funding. The ministry has also called upon affected workers to continue offering services voluntarily during this period. Contracted staff willing to continue working in the spirit of patriotism are encouraged to contact their respective hospital directors or the ministry headquarters, Dr. Atwine urged. The funding pause ties back to broader U.S. policy shifts under the Trump administration. In 2020, Trump proposed deep cuts to foreign aid, including global health programs. Though President Biden later reversed many of those policies, the current freeze signals a renewed review of America's foreign assistance. Health experts warn the freeze could significantly affect service delivery in Uganda, especially in rural areas where USAID-funded staff form a key part of the workforce. Analysts say the crisis has exposed the dangers of depending too heavily on donor support for essential services. This is a wake-up call. One health policy expert told us, "We must begin to plan for a sustainable, self-reliant health sector." As the July 14th validation exercise draws closer, thousands of workers await clarity on their future. The Ministry of Health insists it's doing everything possible to minimize disruptions. But for many health professionals, uncertainty lingers, and so does the question, how long can Uganda's health sector depend on outside help? For Science Television Network, I am Namono.